Hi, Ms. Baston. My name is Marissa Atkinson, and today I'm going to be doing my video presentation on von Willebrand disease. So von Willebrand disease is a genetic disorder that is a bleeding disorder, and commonly it'll get mistaken for hemophilia, or be called like the sister to hemophilia, which it is not. So the first time that this was observed was in 1925 by Dr. Erich Adolf von Willebrand. He was working with a 5-year-old girl who was having some joint problems and some bleeding issues. And then in 1926 is when we actually had the observation of von Willebrand disease. And to briefly describe who can be affected by this, it can be everyone and anyone. So unlike hemophilia, it is not a sex-linked disorder. It is autosomal, and it is actually on chromosome 12, not the sex chromosome. So what that means is mom or dad can have it, and mom or dad can pass it on to their children, and their children can pass it to their children. And yes, it was found in Europe originally, but that does not mean that that is where this disorder is from. It can be from anywhere. So to briefly describe what von Willebrand disease is and how it affects somebody, is von Willebrand is a factor in your blood that holds your platelets together. So for example, if this is your platelet and this is another platelet that needs to go onto it so you can form a clot, you need a binding agent. That would be the von Willebrand factor. So as you can imagine, if you don't have von Willebrand factor or yours doesn't work, you're not going to form a clot. And another way to think about it is like building something with bricks and cement. The brick is the platelet, the cement is the von Willebrand. If you don't have the cement there to hold the platelets in place, it's not going to form a clot and you will have a bleeding problem. So it is important to understand that there are multiple forms of von Willebrand disease. Generally, you have types 1, 2, and 3 with subtypes in type 2. And for the most part, type 1 is least severe, type 3 is most severe. There are 2 exceptions with type 2 and their subtypes. Type 2B and 2N can also be just as severe, if not more severe than type 3. And by severe, I mean you might bleed more, or you might have an easier time bleeding and harder time stopping the bleed. So to talk about treatments that we have present day, most of it is just dealing with it medicinally. So the first form of treatment that people often go to is called Stymate. It is a nasal spray and it just helps influence coagulation. This is very, very dangerous for type 2 because the way type 2 works, which is a whole nother topic, it would encourage coagulation too much and you can form a clot inside your body, and we all know if a clot moves, you can die. So typically that's not used for type 2, but for 1 and 3, it's great. And then just recently, within the last decade or so, we have 2 medications that the FDA did approve for use in the United States for von Willebrand patients. These are called Listetta and Amicar, both of which can take time to build up in the body, which can be kind of a problem because then it's not working that quickly and you have to take it for a long amount of time for it to work for your bleed, but you can't take it as an everyday medication. And then the last form of treatment that we have presently is using donor plasma. So I actually have some on hand, and this is what it comes in. Typically it is refrigerated and you do have to mix it at home. Comes in a little vial, and then what you would do is you would go ahead and run an infusion through yourself. Typically I do it in my hand, but you can do it in your arm. You just use a little butterfly needle and push it through. That is also one of the most effective. People use that for surgeries and for follow-up care from having a baby. So then another symptom, or if we want to talk about the symptoms generally that people with VWD would have, anyone type 1, 2, or 3 will usually show these symptoms, and it's increased bleeding of like mucous membranes, so your nose or your gums, and that happens a lot when you're growing up and through adolescence, and as an adult typically it slows down. And then one other thing that you might notice is joint bleeds. So if you're a runner or you're very athletic, sometimes you will bleed, and you won't even notice it. It'll just be some weird swelling, some redness, and some heat, and that is actually a hematoma or a bleed under the skin. So then one last symptom that only women will have because women menstruate is very heavy and very long menstrual cycles. And that does come with its own treatment. which is typically a birth control pill of some form, or sometimes people will do like the Depo shot or implants, and that is to make it so they have a menstrual cycle less frequently, so they are going through severe bleeds less often. So those are kind of the symptoms, what von Willebrand is, and the treatments that we have for it presently. But then to summarize and conclude this, currently there's no cure for von Willebrand disease. It's kind of one of those things where we can put band-aids on all the symptoms and treat all the symptoms, but we can't cure it. And there has been more research throughout the years, but the community that has von Willebrand disease is actually pretty small. So there's not a whole lot that they can do right now, but for example, one of the improvements that was found is these patients typically couldn't use anything like aspirin because it can thin the blood. But within the last year, actually since 2018, we have been told now that using things like aspirin is safe instead of just having to use Tylenol. So that's one improvement, but we are still waiting for more treatments to come and more studies to come. And I did want to talk about some stuff genetically really quick. Type 1 and type 3 can be inherited pretty traditionally. If you know anything about genetics and Punnett squares, you can find the likelihood of that. But type 2 actually has its own inheritance, and I would love to get into that, but that would take up too much time. And then to touch on the sources, pretty much all of my information was from these two books. So this one was written by an RN, and she goes over von Willebrand disease and what it is very, very well. And then everything in here is like a Q&A on daily living with von Willebrand disease. So if you were ever interested or wanted more information, that's where you could get it. But I hope that this was informational and kind of gives you the basics on what von Willebrand disease is.